Okay, what's up, guys? I hope everybody's doing well. It is June 6th, 2025. Um, I am done with medical school. It's been almost a month since I graduated, May 16, and this is gonna be my last weekend here in my home state. Soon enough, I'm gonna move to my next location for residency. But before I leave for residency, I wanted to reflect on some aspects of medical school before I leave that in the rearview mirror. So, specifically, I want to talk about my time doing global health work in medical school. So that was by far, I think, the best aspect of the medical school that I went to. I spent 3 months in Turkey, 1 month in Istanbul, and 2 months in the city of Kütahya. um, at the hospitals over there as a final year medical student in internal medicine. And having spent that time there, I um, was able to reflect on their healthcare system and compare it to our own, which was my distinction track project for medical school. I was lucky enough to be able to graduate with distinction in global health. And so I wanted to share that talk before I forget it and move on to residency, because I think both, not just for medical people, but just both for people living in Turkey and people living in the United States, my impression of these healthcare systems um, can teach everybody something. And so I'll be sharing my PowerPoint that I made based on this issue. Um, okay, so let's just get started here. All right. So, an American medical student's perspective on the Turkish healthcare system. And this is a nice picture from Grand Rounds at Bezmialem Vakıf University. And I'll talk about the university in just a little bit. So, for those who don't know, Turkey is a country of 85 million people. Its GDP is 1.1 trillion. In this talk, I'm going to be directly comparing Turkey to the United States. The United States, my country, has a population of 320 million people and a GDP 27 times the size. Um, and if we just look at the map of Turkey here, you can see the city of Istanbul here, one of the largest cities in the world. It has like 16 million people. The capital of Turkey is Ankara, and the city where I spent some time, Kütahya, is right here. Kütahya has, um, I think, like 200,000 people. I think I put it on a slide later. I gave this presentation like 2 weeks ago, but anyways, so overview of the Turkish healthcare system. So I'm going to start this talk objectively. I'm just going to kind of go over, the statistics and stuff, and then I'll go into the subjective part, which is my own experience. And so this is kind of the opposite of what we do as doctors, because as doctors we do subjective, objective. But anyways, um, so Turkey has this universal healthcare system, which was launched in 2003. It covers 100% of the population, and it covers pretty much most primary preventative and emergency care services. Um, Medications are paid for out of pocket, but most everything else is covered. In this figure here, you can see like the percentage of beds uh, owned by the government and the percentage operated by private hospitals. And as of kind of the latest date on this study here, uh, as of 2018, about 80% of beds, meaning 60% of 80% of beds were covered by the government, whereas 22% of hospital beds were covered by the private sector. So MOH is Ministry of Health. So 60% are what's called Devlet Hastanesi or Şehir Hastanesi, where it's just like a public hospital. 18% are university hospitals. So these are also public hospitals, but with teaching. Um, okay. And so in private hospitals, you need to pay out of pocket for services, and in public hospitals, you're covered under this universal health care, which was launched in 2003. Um, I'll get a little bit more into the statistics of the healthcare systems in just a little bit, but I also want to compare our medical education system. So, how do you become a doctor in Turkey versus how do you become a doctor in the United States? So, in the United States, you don't see that on this slide here. I'll just talk about it. Um, in the United States, after you graduate medical school, you spend at least 4 years. Some people, if they try really hard, they can do less than 4 years, but for the overwhelming majority of people, at least 4 years in college to get a bachelor's degree. And then at least 4 years in medical school. And then after medical school, you do a residency, which can range from 3 years, like internal medicine residency, to 7 years. And then after residency, you can practice as a doctor, as like an internal medicine doctor or general surgeon or whatever. Or you can do a fellowship to become a more specialized doctor. So, like for example, you can do 3 years of internal medicine residency, and then you can do 2 years of further training, aka fellowship, which is basically just another residency, to become an endocrinologist or a pulmonologist, or you can do 3 years of training to become a cardiologist or to become a gastroenterologist. So that's the training in the United States. And personally, for me, I spent 5 years as a pre-med in the United States. I spent 4 years in getting my bachelor's degree, and then because I wasn't ready to apply to medical school because my grades weren't where they should have been at that point, and because my, volunteering and stuff like that was a bit subpar, I took an extra year. I did a year of graduate school, and then I went to medical school, which is very common. It's called a gap year to take 5 years of pre-med or 6 years of pre-med because it's getting so hard to get into medical school in the United States. Okay, now let's talk about Turkey again. In Turkey, um, you have 12 years. You have 12 years of primary school, right? Okay, so just like the United States, 12 years of primary school. And in the 11th grade, they specialize into the science math track, or you can specialize into other tracks, but people going into medicine specialize into this track. And then there's a 200 question entrance exam into medical school directly out of high school. There is no such a thing as pre-med over there. Um, that 200 question entrance exam is very high stakes because medical schools over there, unlike our medical schools, they don't care about letters of recommendation and volunteer hours and shadowing hours. And it's just one thing that matters. It's this 200 question high stakes exam. It's called I think it's called the Yüksek Öğretim something, Yüksek Öğretim Sınavı, something like that. Um, the YOS exam. Anyways, very high stakes exam. Um, and then when you get into medical school, it's 6 years. So years 1 to 3 of medical school are preclinical, where you go over like anatomy, biochemistry, microbiology. Years 4 through 5 are rotations. They call you a stagiaire, like a rotationist. In other words, it's equivalent to our third year of medical school. And then year 6 is the intern year where you take on more of like a technician role so you can study for the residency entrance exam. And I functioned as an intern during my rotations in Turkey. So I'm going to talk extensively about what interns do in Turkey in just a little bit. After medical school, this is different than in the United States. Without doing residency, medical students in Turkey can practice as general practitioners, basically like family medicine doctors here. Um, and regardless of whether or not they want to do residency, they have to practice as a general practitioner for at least a few months. And they also get sent to like some random region in Turkey to do this Mecburi Hizmet, this required work in Turkey. The medical specialization exam, which is taken at the end of the intern year, the TUS exam, I forget what it stands for. Tip Uzmanlık Sınavı, the medical specialization exam. Yeah, that's what I wrote. 200 questions, also high stakes. So again, for residency, I had the USMLE Step 2 exam, which was graded, and I also had to take Step 1 before that. Um, and but also I had other things that mattered. I needed 3 letters of recommendations. I had all of these interviews. Um, they cared about extracurriculars. In Turkey, only one thing matters, nothing else. This 200 question exam. Oh, and by the way, step 2 is like I don't remember how many questions it was, but it's way more, many more questions than this and way longer. So really, this like 200 questions is very high stakes for them. Um, okay. All right. So pros and cons, because I don't think I went over that. Um, so in my opinion, what are the pros and cons of the education system in Turkey versus in the United States? Number one, I'm 27 years old. Okay. And I just got my MD. And I just feel like those 5 years of the pre-med, getting a bachelor's degree, studying biology, getting a master's degree in biology, even though I was, even though I always wanted to be a doctor, um, was a complete waste of time. Pretty much all of it is going to be useless in my future. And I just think about the years I spent studying this garbage, organic chemistry, general physics, all this other stuff which has zero application to medicine. Now, in Turkey, they do study, they don't study organic chemistry, but they do take like chemistry classes, physics classes, math classes, just like we did, but only in high school. They don't take this stuff again in college. They don't waste years of their lives on something that's not going to be useful for their career. So number one, that's a pro for Turkey, that they don't have pre-med. They go straight out of college and straight out of high school. And because they go straight out of high school and medical school is 6 years over there, they graduate at the end at age 24, whereas we graduate at least at the age of 26. Um, and so, I will tell you that, for me, internal medicine was the right specialty for me. But one of the reasons, among others, that I didn't consider doing something longer or something harder like surgery was because I'm already 27 years old. I was 26 when I was applying. Um, as you go into your mid to late 20s, your priorities in life start to change. Um, in Turkey, if they're graduating at 24 years old, normally, some of them graduate at 25. They're still younger than pretty much most of the medical school graduates in the United States. So even if they wanted to take like 2 years off to do research in America and then do residency in America, they would still be the same age as us. So again, that's a pro for Turkey. Some cons to the Turkish education system, in my opinion, uh, can be argued. So first of all, these entrance exams into medical school and into residency are very high stakes, and they're the only thing that matter. So, like for example, I remember having uh, dinner with one of my colleagues in the city of Kütahya. And she told me that she had when she took that entrance exam after high school because she has anxiety, she got all of the questions right, but only the first 60 questions. She didn't answer the other 140 questions because she ran out of time. And so that's why she was at Kütahya instead of, a more harder school to get into, such as, Koç University or Medipol or Acıbadem or some of these bigger name schools or, Istanbul University, Hacettepe. She was at Kütahya. So these exams are very high stakes. So that can be considered a con. In my opinion, it's still a pro because you don't have to do all this other garbage over there, like shadowing, volunteer work, letters of recommendation, evaluations. So yeah. So that's just my opinion on the Turkish medical education system. Uh, with that being said, there is brain drain in Turkey. The rate has increased significantly. So you can kind of see that here in this figure on the right, where in 2015, about 1.6% of people graduating higher education, meaning like any college, wanted to leave Turkey. Whereas now it's 2%, more amongst males than in females. And the biggest factor for this is income status. And so these are some of my colleagues. They were doing a rotation in the United States. And the biggest destinations for people leaving Turkey are the United States and Germany. And so they call this a brain drain, right? Because the smart people are leaving the country. Obviously not a good thing for the country. Um, and I'm not going to get too deep into politics, but these days, the United States might be having its own brain drain with our NIH funding getting threatened and Donald Trump basically waging a war against research. But I'll just leave that there. So income status, let's talk a little bit more about that. Statistical comparison of the two healthcare systems. So just looking at the income status in the United States, a primary care doctor, like somebody who does the minimal training, they make $260,000 a year on average. In Turkey, they make significantly less. Now, to be fair, I'm not sure if this is 30,000. I did a lot of searching on what the salary of a Turkish doctor is by year, and this is what I found, 30,000. It might be like 40,000, 50,000. But regardless, they make less than a resident. In a couple of weeks when I start residency, I'm gonna make a $65,000 a year salary. So, a physician in Turkey makes less than a resident. So, it's really kind of a shame for the doctors there, how little they get paid. But of course, I should also mention, I forgot to mention, they don't have debt over there. I have $200,000 in debt. They don't have any debt. So that's also worth mentioning. Um, the healthcare spending. So, well, let's go here. Patient satisfaction. In Turkey, before the universal healthcare system was implemented, patient satisfaction was 40%. Now it's 76%. I mean, I'm not in 2011, it was 76%. So basically, there's this huge jump in patient satisfaction from before and after universal healthcare was implemented. In the United States of America, where we don't have universal healthcare, still, as the richest country on earth, our patient satisfaction is dipping. It's going like this. 60% in 2003, 53% in 2011, I mean 59% in 2011, and now 44% in 2024. It's a real shame. Uh, Life expectancy is still a little bit lower in Turkey, and of course, I'm sure this varies by province and region, just like in the United States. Um, but both Turkey and the United States have significantly lower life expectancy than most EU countries. So, like in Germany, it's 81.71. Healthcare spending as a percent of GDP. In the United States, even though we don't have a universal healthcare system, we still spend 17% of our healthcare and GDP on 70%, 17% of our GDP on healthcare. In Turkey, 4.5% of their GDP is spent on healthcare, and they have a universal healthcare system with pretty good patient satisfaction. In Germany, I just wanted to include an EU country here, 13% of the healthcare, 13% of the spending GDP is spent on healthcare. So, basically what you see here, and the reason for my project, and this is a lot of words, you don't have to read it. In fact, I'll just talk here. The reason for my project is that, in Turkey, you have 4.5% of their GDP going towards healthcare, but their patient satisfaction is better than ours, and their life expectancy, despite being a significantly poorer country, is almost as good as ours. Um, and so, what can we learn from the Turkish healthcare system as Americans? So that was the purpose of my global health project. Um, so, anyways, uh, where was I? So, anyways, just kind of the outline of this presentation here. That was the objective, statistical overview of the Turkish healthcare system. Now I want to talk about my own subjective experiences in Turkey. So I rotated in two sites in Turkey, Bezmialem Vakıf University in Istanbul. You can see that here on the left. This is the hospital, Bezmialem Vakıf University Hospital. This is the outpatient center, and not pictured as like the university and stuff. And then this is the hospital for Kütahya Health Sciences University, Kütahya Sağlık Bilimleri Üniversitesi, which operates out of like the main hospital for the city, Kütahya Şehir Hastanesi, and also the other public hospital. There's two public hospitals. I forgot the name of this one. It had a nice name too. Yeah, but there's two public hospitals in Kütahya, well, actually, there's two public hospitals and a psychiatric hospital, which are connected to this university. And so Bezmialem Vakıf University, semi-private. So the medical school itself is a private institution, and then the people who pay, they have to pay the patients, they have to pay money for it. but still compared to like some of the more prestigious private hospitals in Istanbul, like say Koç University Hospital or Nishan. Well, Koç University has an American hospital in Nişantaşı, but like or like I don't know, Medipol or Acıbadem or whatever, you don't pay as much. And then the location of this hospital is in Istanbul, a huge city. Sorry, I shouldn't be eating. Huge city, 16 million people. So yeah, here's some pictures of Bezmialem Vakıf University. This is me in the like right around here somewhere. This is the university here. It's like a square with a courtyard in the middle. And then I took this from the sixth floor of the hospital. So I'm standing in the hospital right now when I took this photo. These are like the clinics of the hospital, and these are some things on like the first floor of the hospital. This is like a dentistry building here, and then this is the main gate. And then you can just see like the beautiful city of Istanbul, just part of it, not like the touristic parts. But like you can see here, like Yeni Kapı is here. Um, Beautiful city, historic city of Istanbul. And then compare that to Kütahya Health Sciences University. This is a public teaching hospital located in Kütahya, roughly 250,000 people. So 250,000 people, it's like a lot, but significantly less than Istanbul. So I felt like I was in a small town while I was there. Even though the college town that I live in has about the same amount of people, but though I'm going to talk about this a little bit later. I mean, the way Turkish cities are structured, 250,000 feels like a small town. And I really enjoyed and appreciated just how amazing, public transportation was there and just like the design of the city where I can walk from one side to the other. Um, and so here you can see part of the city of Kütahya. And this is like free lunch. So like something I really appreciated about Turkish hospitals is that all the employees get free lunch and dinner and breakfast. And so you can see I'm enjoying this like delicious lunch while looking at this amazing view here in Kütahya. And yeah, this is me just standing on the sixth floor of the hospital. Um, so these are the two hospitals, and I'll compare them in a little bit more detail later. But in terms of like the typical day of a medical student in internal medicine, they're pretty much the same. They're very similar between the two hospitals. The difference is more on like the patient care side, which I'll talk about in a little bit. But um, like, what does an intern do in Turkey? So a final year medical student, a sixth year medical student in Turkey is called an intern. Uh, Now, in the United States, like, so, um, so like I just completed my fourth year of medical school, my final year in the United States. In the United States, fourth year medical students are called sub-interns, sub-Is. And basically, what we do in internal medicine is pretty much the same thing as the interns, which that's a term used for the first year residents in the United States. In other words, we'll follow about 4 to 5 patients. We'll pre-round on them. We'll get to the hospital at like, 6:30 to 7 a.m. Pre-round on the patients, and then write some notes, round on the patients, eat lunch, write some more notes, put in orders, things like that. So basically, we're doing the same job as the residents. Now in Turkey, it's significantly different. The intern is basically like a technician over there. So let's talk about that. Um, so like a typical day as somebody on the internal medicine service there, you arrive around 8 a.m., which is nice because like here in America, we arrive a lot earlier. And then you get stuck with these morning duties. So like a lot of just like what I want to say is it's nonsense tasks. Like what we would do is like we would find and I can just show you here. We would find like the patient vital signs or like the patient like ins and outs that the nurses wrote on pieces of paper. snap pictures of these and then send them to the resident following these patients on WhatsApp. I mean, it's really insane. It would take us like at least 20 minutes just to do this. Whereas in America, all of this information is already in Epic. So it's yeah, I don't know. It's kind of insane that we spend so much time on that. And you can just see me doing that here at Bezmialem Vakıf University here on the left. That's me. That's another intern colleague, and we're taking pictures of the vital signs, so that during rounds the residents can go into WhatsApp and find the picture and give it to the attending physician should he or she ask about it. And here, this is the intern workroom in Kütahya. And what they're doing here is they printed out the lab values from the computer, and now they're transcribing those lab values into like a table because it's easier to see the lab values side by side, tracked day by day. Um, which is, you know, to be fair, during pre-rounding in the United States, we also kind of transcribe the lab values just so it's easier for us to follow. But um, the reason they do this is not because they're going to present the patient, but because in case the resident wants to look at these folders. Um, so yeah. Um, and yeah, both hospitals use patient charts. So these are some examples of the patient charts, paper charts. They use paper charts. Um, and so I actually preferred this compared to the United States of America, because in America, we'll write these long notes every single day. But over there, you can just like see here for this patient. So this is from a Google Doc file. They put all their patient information into a Google Docs file, and then they update it by like one paragraph every day. So like for this patient, let's see, uh, they have like the reason the patient came in, like hypoglycemia, hyponatremia, very short initial history, some other stuff from the patient's history, lab values, and then over here they have like a paragraph for every day. And then you can see the patient's vital signs here, and then their ins and outs, like how much they peed or you know uh, pooped or whatever. Um, and so we would take pictures of these like every single day and just put them into WhatsApp in case the resident needed them during rounds. But like we didn't actually follow any of these patients. So like for the most part, unless we actively put in effort, which I did, but most people don't because they don't have to. But like unless we actively put in effort to like know what's going on with our patients in a detailed manner, as interns, we really weren't following any of these patients. Like we didn't know. Um, during rounds, we would listen though. And then anyways, after pre-rounding, after doing that stuff, we got morning rounds. And just like in the United States, there's two types of rounds. And for those who aren't in the medical field, rounding is when like all of the doctors on the team, meaning all of the residents, all of the medical students, and the attending physician come together and talk about every single patient. Internal medicine loves to do rounds. Um, and so rounding can sometimes happen where everybody's sitting down at a table, or it can be um, where you walk around the whole floor. My experience in Kütahya was, generally speaking, we would do walking rounds, um, but sometimes we would do both morning table rounds and walking rounds. At Bezmialem Vakıf University in Istanbul, we would do like a quick table rounds, and then I mean we would do a long table rounds followed by a quick walking rounds. Um, and just like in the United States, I mean, it's different for every physician. Generally speaking, in the United States, we do walking rounds only. We don't do table rounds, but I think it's something that happened during COVID where table rounds are becoming a little bit more common. Um, and so personally, I really appreciate table rounds because at Bezmi one of our professors would always bring like this amazing like Turkish bread simit, and we would all have tea and stuff. And then we would just listen to these, intellectuals talk about their patients. I mean, I really enjoyed it. Um, we didn't really get free food during morning rounds in Kütahya, but again, like you can see all of the residents here. talking about their patients, and then me and the fellow interns, final year medical students, were kind of sitting in the side of the room listening in. Um, and then so this is what morning rounds looks like in Turkey, and then this is like walking rounds. In Kütahya, so both of these pictures are from Kütahya. Lots of people, right? So generally, I'll talk about this a little bit more later, but public hospitals, one of the biggest criticisms of them compared to private hospitals in Turkey is that, oh, the patient load is huge, which is true. The patient load is really big, but also there's significantly more doctors, and you can just see that here. Um, Not everybody in this picture is a doctor. Some of them are medical students, but just the teams are a lot bigger. Um, Gift giving, so patients giving gifts to doctors is a lot more common in Turkey, whereas it's like unethical in the United States. But I really appreciated this culture because I had a lot of good, Turkish sweets um, during my time there. And you can see that here. Um, this patient is giving like some gifts to the attending physician, and attending physician's like, yeah, neden zahmet ettin? Like, why do you keep doing this? Like, so that was like a funny moment during rounds. The patients in Turkey are so nice. They're very grateful and very sweet, especially like the older ladies. Um, so then, yeah, I was talking about lunchtime, my favorite time in the hospital in Turkey, because you get all this amazing food for free. I mean, in America, unless I manage to make it to the internal medicine conference, generally speaking, I have to pay like $10 for lunch. But here I just have this amazing lunch with like, süt laç, this great dessert, soup, spaghetti, some other stuff. It's all for free. And I sit with my colleagues, we have some good conversations. So I really appreciated lunchtime there, and that was free. Um, a similarity between Turkey and the United States is these drug rep presentations. So here from my experience in family medicine, uh, at university hospitals you don't get drug reps, but in America. But if anybody's done like a family medicine rotation, there's gonna be these people who come to your office and they'll like talk with the attending physician and pretend to care about his family or whatever, and then they'll like give this presentation on a drug. But then they'll also give free food. So it's the free food that really does it. Um, Both in America and in Turkey, they bring good free food. So yeah, it's just interesting that we have that aspect in both countries. But the free food is good. Like this is pita with some iron. It's good stuff. Um, and then in the afternoon on the inpatient service, we'll continue these tasks, which are, in my opinion, not necessarily meant for doctors, like replacing dressings, panzement in French, but panzement in Turkish, um, or replacing catheters, or taking EKGs of new patients, stuff that medical students do not do in the United States. But there would be a lot of downtime, and we would hang out and enjoy Turkish coffee. These are some of my colleagues brought like cake on this day, so this was a good day. But we would do that a lot. We just hang out in the intern room because in America, when our tasks are over, especially as like third year medical students, we can leave at like 2 p.m. As final year medical students, we stay the whole time in America. And also in Turkey, even if they're not following a patient or they don't have anything to do, they have to be there until like 4 to 5 p.m. until afternoon rounds. Um, okay. But for me, oh, and then night shifts. Yeah, I had the opportunity to participate in some night shifts. They were fun and not much to talk about. Even though they were pretty chill. Like here, we watched like a Fenerbahce game. Like my favorite Turkish soccer team was playing this day, so very chill. And so anyways, Yeah, and then we have afternoon table rounds. So internal medicine means rounding. So, but I as a future internist, I always enjoyed these rounds. I mean, just watching all of these, intellectuals talking about their patients, I always enjoyed it. Uh, but of course, there were days where I was like, I've been in the hospital for so long, I just want to go home. And especially because we're not following our own patients. But yeah, you can see here, this is Kütahya and this is Bezmialem on the right, afternoon rounds. Something I had noticed is that the length of stay is significantly longer for patients in Turkey compared to the United States. And I think that's because the patients aren't paying. So like in the United States, um, if you have a patient admitted to the internal medicine floor, like and you're following them, this has been my experience, you know, throughout my internal medicine rotations here in the United States, where after like the third day, the patient will be like, "Can I go home now?" And I think that's because the patient is like a number of reasons. One of them, the hospital, sleeping in the hospital is not fun, but the other one is, they're paying, in the United States for every day, a lot of money. Um, in Turkey, again, I don't know exactly why, but in Turkey, we had patients who would be in the hospital for like 2 months, and we would have patients getting admitted for one problem who would stay for another problem. So the length of stay was really long. Um, and this was like one of our patients we got to know because he was in the hospital for so long. Very nice guy. He gave us some gifts before he was discharged. Super nice guy. Um, and in fact, I still have some of his gifts in my room. So yeah. So I really enjoyed the gift giving culture there in Turkey, even though I understand why it's not ethical. So now I want to talk about clinics in Turkey. So I'll just show you the pictures and then I'll talk to you guys about it. So these are the waiting rooms in Turkey. This is Bezmialem. This is Kütahya. And this is like the inside of the clinic room. Like this is Kütahya. You can see the attending physician here, the residents, the secretary, and then here you can see the medical student, the attending physician, and the secretary. So whereas in America, so the whole organization and structure of the clinics is different in Kütahya compared to America. I mean, in Turkey compared to America. Because in America, the way the clinic functions is that you have a central workroom where all of the doctors are, and then the patients, first they wait in a waiting room, and then they wait in their own clinic rooms. And then the doctor is the one who moves to these clinic rooms. Whereas in Turkey, the doctor has his own clinic room where the resident and the secretary hang out as well, and the medical student. And all of the patients wait in this central waiting room. Um, and so, there were times where like and so the patients have to wait a long time, and uh, the doors would be locked. Like at Bezmialem, they would lock the doors to make sure patients don't go in. At Kütahya, the doors weren't locked, but like if the patient went in before it was their turn, they would be reprimanded. Hasta var, you know, get kites, or get out of the room. So the wait times, unfortunately, are very long in Turkey. Um, but that's in both public and private hospitals. From my own subjective experience, I don't think the wait times were significantly longer in public hospitals in Turkey. Um, and I think that's important for me to point that out because one of the arguments against having a public healthcare system in America is, oh, the wait times would be so long, but like that's not what I saw. I mean, they were long in general, but not longer in one than the other. Um, okay. So, uh, some other aspects about clinics in Turkey is that when I told them that in America we see like one patient every 30 minutes, they found that amusing. They were like, wow, I wish it was like that. Because in Turkey they see a patient every they see like 100 patients a day. They see a patient like every 5 to 10 minutes. And because of that, again, the notes aren't as detailed in Turkey. Basically, they listen to the patient's complaint and they say, oh, you should take such and such medication. Um, if a physical exam is warranted, they'll do the physical exam, but they won't do a physical exam on every patient. Whereas in America, we'll do a physical exam on every patient. We'll take a detailed history on every patient. We'll write very long notes for every patient. Um, and so again, I don't think 5 to 10 minutes, usually like 5 minutes, is enough time for patients. Um, but at the same time, I we write very long notes in America for no reason, in my opinion. Um, okay. So what else? Yeah. So within internal medicine, there is this role of the what's called the dualist. So um, this is both in America and in Turkey. So I'll just talk about America. In America, I can do a 3 year residency in internal medicine, and then I can practice as an internal medicine doctor um, after those 3 years. Um, Either as a primary care doctor in the clinic or in the hospital as a hospitalist. But very rarely I can work as both a primary care doctor and as a hospitalist. And that role is called a dualist. But in Turkey, pretty much, in my experience at these two teaching universities, pretty much all of the internal medicine doctors are dualists. And, personally, I think the dualist role is nice because like who to admit to the floor, um, and on the floor, and within the hospital, not in the clinics, uh, you can also give them like advice that a primary care doc like that a clinical primary care doctor would give to their patients. So like for example, this is one patient who came to the clinic room with like this crazy rash on her legs. I think it was lichen planus. Um, that's what the team thought it was. Because I'm not that smart. Um, but like, yeah, so we saw this, and then she had some other symptoms, so we said let's admit her to the floor. And also down here, you can see we're enjoying some nice Turkish snacks. This is Ülker biskrem and some tea. Biskrem, I think tutku is better than biskrem, but anyways, uh, Turkish snacks, very good. Um, okay. The emergency department in Turkey. So the ED in Turkey is significantly different than in the United States. So you can see, like, this is a picture of me and some interns in the ED. The ED has 3 zones in Turkey. So in America, there are no zones. You just come and then you're triaged based on your severity. So like if you're not severe, you'll just wait a really long time in America, like maybe 2 hours even. In Turkey, there's 3 zones. There's a green zone, which is basically a primary care zone where patients don't really have emergencies, but they might have like a flu or something. So it's urgent care. And then you have a yellow zone, which is like in between the most severe and the least severe. And then you have a red zone, which is the most severe patients, which would be like what I saw when I was there was acute heart failure, like hypokalemia, low potassium levels, pneumothorax, things like that. So it's just some notes about these. The green zones in Turkey are staffed by interns, by 6th year medical students. And I think this is this conduces really good training in Turkey for interns because like they're the ones making the decisions, they're the ones giving the medications. So you learn a lot during your 2 months as an intern in the emergency department in Turkey. But also some patients, they're not that some patients would rather see, a real doctor than a medical student, which I understand. And also, a question I had about this was like, how are you as an intern confident about what you're doing? But the thing about primary care is that like it's more procedural than you think it is, and the green zone is basically primary care, and so you'll have like a textbook or something where it's like, oh, for upper respiratory infection, we're going to give Augmentin, and for this, we're going to give this. Speaking of which, antibiotics are overutilized in Turkey, but I won't get into that. That's a whole other thing. But yeah, there is some utilization of the ED in Turkey. So like like I heard like I didn't see any like I in my subjective experience, I never saw anything where I thought, oh, why is this patient even here? But from talking with colleagues, I mean, I heard stories about people calling like ambulances for no reason. Um, and again, is that because it's free? I don't know. Uh, the yellow zone is like mid, like people will come in with like undifferentiated chest pain or something. And one of the residents mentioned defensive medicine to me, like they'll run CT scans and stuff when they don't need to because they don't want to get sued. And, so I don't know too much about that, but it's something worth mentioning. So yeah. So overall, what are my thoughts on the role of the final year medical student of the intern in Turkey versus the United States? There's some pros and there's some cons. The cons is that the interns do a lot of useless tasks in Turkey. They'll be transferring patient data, taking pictures of vital signs on WhatsApp, or they'll be doing these roles which medical students do not do, like catheters or blood draws, arterial blood gas, or dressing replacement, or like even like calling radiology to schedule an appointment to get an X-ray on a patient. And then even in the clinic, the medical student basically just shadows. So I don't think the interns learn a lot in Turkey. On the other hand, there are some pros. So the interns do make some money in Turkey, whereas you don't make money in medical school in the United States. You actually lose money, $200,000 in debt. Uh, and some interns prefer not following patients or doing anything that's, you know, would take too much of their time because they have more time to study for their TUS exam, for their residency placement exam. And then the other thing is like I had never drawn EKGs um, or like replaced catheters or drawn arterial blood gas before I went to Turkey. Um, and so those are kind of fun, those tasks, but I just don't think we have to do them every day. Um, okay. So now let's compare the private and the public healthcare systems. Because, I was in a private system, Bezmialem Vakıf University, and I was in a public system, Kütahya Health Sciences University. So, first of all, if you go to YouTube or if you just like try to read about it online, you can find a lot of things said about public hospitals in Turkey. And so the stereotype is that public hospitals have a lot of patients and the staff are rude. That's basically the stereotype if you kind of look into public perceptions of it. Um, Now, my own perspective as an American medical student was that in public hospitals in Turkey, there are more patients, but there's also a lot more doctors, at least for Kütahya Health Sciences University. And so wait times, the patients still wait a very long time, and I feel bad for them. Um, but they're not significantly more than in a private hospital. Like I didn't notice significantly longer wait times at Kütahya Health Sciences University compared to Bezmialem Vakıf University. Um, but again, like the patients will show up in the morning for clinic and then they'll leave at like, 3 p.m. So they do wait too long. Um, and the staff are blunt. Like if a patient walks into the room when they're not supposed to, they'll be swiftly reprimanded. Um, and not just that, but just like the way the doctors talk to the patients in Turkey, both at private hospitals and public hospitals, just as a cultural thing, the staff are blunt. They'll say something like, why are you eating so much sugar and stuff like that. They'll say, şeker hamur yok, stop eating so much sugar and dough and stuff, Or if a patient is like being non-compliant, the doctor will straight up say like, why aren't you complying? Like I had one patient who with a diabetic foot who was hospitalized for 2 months and he wouldn't lift his foot, high like we instructed him to. So the doctor was like, why aren't you doing, why aren't you listening to us? Why do you always keep it like low like that? And so the doctors are very blunt with the patients, like almost patronizing, but it's a public thing. I mean, it's a cultural thing, not a public thing because it's at both hospitals. Um, I don't think they're rude. I just think that's just how it is. And the patients will refer to the doctors as hoca. Um, and so there's like a hierarchy, like a respect thing for the doctors. Um, so yeah, that's just a cultural difference. Um, and I will say, people talk about how like in the United States, um, our healthcare system is the best and like we have the best treatments and stuff. I mean, sure, like if you're a really rich guy, like if you're a millionaire, our healthcare system is great because we do have all I mean, we do have like most of like the newest advances in medication happening here in the United States. And hopefully it'll stay that way as long as our new president doesn't cut all of our research funding. Um, but for like the common man, like for people with like, or just people with like normal, people with common conditions like those you see in internal medicine, I saw like zero difference in treatment in America versus the United States. Um, and I had a lot of respect for the doctors in Turkey because in America as an internist, there were times where I felt like a secretary. Not as an internist, but as a medical student in internal medicine, because, we would just be like consulting different parts of the hospital for every issue. Oh, there's an AKI. What does nephrology say about it? Um, so, but in Turkey, these doctors, they really had, they were really on their game with nephrology, rheumatology, pulmonology, hematology, you name it. Like they had all these like things of internal medicine, all these algorithms, tables, whatever in their heads. I mean, I had a lot of respect for the knowledge base of doctors in Turkey. So yeah, overall, private versus public hospitals, I don't think there was a big difference in patient care. Um, but patients unfortunately have to pay more at private hospitals. Um, Now, again, for surgery or for technical specialties, private hospitals might be better. But for like primary care, I didn't see a major difference in patient care. That's just my own opinion. You'll hear different things from different people. Like most of my colleagues at Bezmialem Vakıf University had not very nice things to say about public hospitals. And most of my colleagues not most, but some of my colleagues at Kütahya were like, you know, a private hospital would have been better, and I was like, no, it's pretty much the same thing. So yeah. Um, the private hospitals did have slightly more didactic opportunities because they had less patients though. So like at Bezmialem, I would get there at 8 a.m. Then we would have an hour-long lecture before we start the rest of our day. And medical students would have more opportunities to present. And so these are some pictures of me presenting in Turkey. But in the public hospital, there was a lot of stuff going on for the patients. Like they had like seminars every week for patients. So like this was a seminar where they're doing exercise with the patients. A physical therapist is teaching patients ways to exercise. So that's my perspective on public versus private hospitals and the Turkish healthcare system. Uh, what about my conversations with other people? So here on the left, this is one of my friends and colleagues in Kütahya, Berk, and his father. And we sat down and had tea one day, and I asked him, as a citizen of Turkey, what's your opinion of the healthcare system? And he told me, he's pretty content with the healthcare he receives here. He doesn't pay for it. I mean, he does through taxes, but like he doesn't pay for it when he goes to the hospital, and he's content with the care that he receives. Um, but when you ask your fellow doctors, and then you hear different things. So like I asked one doctor if she's content being an internist, and she said that she loves her job. She's married to a cardiologist. She loves teaching. She loves all the different, diseases and all the different things that you do as an internist in Turkey, whether in the clinic or in the hospital or in the classroom. But she doesn't get paid much. Doctors in Turkey make, like I said, I don't know exactly how much they make, but they make less than residents in America. And she told me herself, she was like, a fellow in cardiology makes more money than I do, but she loves her job. So again, but so that's what she told me. An attending physician told me. But I talked to a lot of residents who were like, if I could go to America, if I could go to UK, I would do it. If I could go to Germany, I would do it because they pay doctors more over there and they don't get worked as much as we do. And so overall, I think in in uh, in Turkey, uh, the their healthcare system is better for patients because patients don't pay. They don't become sick and then become bankrupt. Um, but it's not good for doctors because doctors don't get paid enough over there. Um, yeah. But with that being said, it's still, becoming a doctor is still one of the highest professions in Turkey because it guarantees you a job. And unemployment is very high in Turkey compared to the United States of America. Um, so yeah. Let's see what other slides we have here. Yeah, what can we take away as Americans about the Turkish healthcare system? So here on the right, so again, do we have universal healthcare in America? No. I mean, maybe to an extent, I'll get into that a little bit, but for the most part, no. We have these insurance companies. And the thing is like, so like let's look at the state of Nebraska here. You have Blue Cross Blue Shield basically covering everybody in that state. And so you have this insurance company, this business, uh, marking their own prices. You have a monopoly basically. And so is this capitalism? It's not even capitalism, it's a monopoly. You have one business in every state for the most part. In some states are a little bit more competitive, but for the most part, you have one health insurance company determining the prices for things, determining what to cover and what not to cover. And in fact, if you guys follow the news, like a few months ago in America, one of the one of the CEOs of a health insurance company was shot in the head by a patient. I mean, patients are not happy with their healthcare in America for the most part. Um, and so compare that to Turkey, where you have private health insurance companies, you have private health insurance, you have private healthcare systems like Bezmialem, Koç, Medipol, Acıbadem, but you also have a public option. And so there's no private hospital in Turkey that's going to charge you, an insane amount of money, um, because then you're just going to go to the public hospital. You're not going to take it. But here in America, so that's true capitalism, right? That's true competition. That's true competition, lowering down the market prices like an invisible hand. That is capitalism. That is what Adam Smith wrote about all those years ago. But here in America, we have, these monopolies. And so in my opinion, so like I wrote here in the USA, we have a stagnant life expectancy. In fact, like last year, the life expectancy went down. Um, we have decreasing patient satisfaction, and 8% of the population doesn't even have health insurance. So they're screwed if they get sick. And they have zero preventative or primary care, which means they're more likely to get sick. Um, but we do have this thing called Medicaid in America, where if you make less than like $25,000, you do have a form of universal health care. The thing is, nobody in America is making less than $25,000. Basically, anybody with a job is making more money than that. Um, and so, really like wh- uh, okay, I forgot what I was saying, but in my opinion, what we could do is we could expand Medicaid to cover everybody to have a public option. And so what that would do is that would lower the prices that these insurance companies set on people. and it would have them give more reasonable coverage as well. So, anyways, we have a lot of work to do in the Turkish healthcare system. What do I have next? Yeah, the Turkish healthcare system is far from perfect. But as Americans, we can learn from their healthcare system, especially with them having a public option to their healthcare system. So that's just my opinion. Uh, what, in fact, in my opinion, as a future physician, first of all, let me put it this way before let me just organize my thoughts here. Doctors make a lot more money in the United States, but the reason healthcare is so expensive in the United States is not because of doctors, it's because of these insurance companies. But with that being said, even with that being said, I would be willing to make less money as a doctor if our education system wasn't so expensive, if I didn't have $200,000 in debt. And so we also need to fix our education system in America. It's insane that I'm basically being punished for trying to elevate my socioeconomic status. That's basically what happened. I mean, I went to medical school. I worked my butt off, both to do go into a respectful profession, which is medicine, a profession which I enjoy, and also to elevate my socioeconomic status. And what do I get in return? $200,000 in debt. I mean, we have a lot of work to do in America, both in our education system and in our healthcare system. All right. So, so that's what I have to say about the Turkish healthcare system compared to our own. And I'm happy to answer any questions in the comments. Um, Now I want to spend a few slides talking about cultural impressions. When I got back from, Istanbul to America and uh from 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 Kütahya to America, for the first couple of days I was kind of depressed because there's some aspects about life in Turkey. I'm a proud American. I enjoy living here, but there's some aspects about life in Turkey which I really enjoyed, and I think we could take away from as Americans. Um, so I just want to talk about that. So let me just reopen my slides here. Not this. One sec. Okay. Okay. Yeah. So first of all, you can see here, these are some pictures in the beautiful city of Kütahya. You can see like the hills in the background. Kind of over here to the side is like the castle of Kütahya, way back here. You can't see it in the picture. This is like the main street of Kütahya. And I really enjoyed the walkability of cities in Turkey. So the place where I lived in Kütahya, I could just leave my hotel room and go straight to the grocery store or to the bakery, or to a coffee shop in like 2 minutes. And I just think that that contributes to a much more healthy society, um, both from a mental perspective and from a physical perspective. Because in America, I'm gonna be perfectly honest, where I live right now, it's an apartment complex surrounded by a bunch of houses. So when I come home, uh, I don't want to leave home again because there's no point. It's gonna be this whole thing where I have to go, drive 30 minutes to the grocery store or whatever and come back. Um, and so just the design of cities in both in Europe and in Turkey, I think is better where you can actually walk places and you're not dependent on the automobile and you don't feel like I mean, it's an exaggeration, but there are times when I feel like I'm kind of like in jail, like at home, because it's just, I don't know. I just really enjoyed getting out more in Turkey. So like this, like on one day, I got out of the hospital at 4 p.m. and as I was walking home, I decided to get some ice cream, and just, well, this is helva with some ice cream in the middle. Very nice snack. But like, I just decided to get that and like sit on a bench because it was a nice day, but in America, like, I just get into my car and I drive, So, um, yeah, I enjoyed the walkability of cities. The other thing, public transportation. So, in Istanbul, I took the metro every day to work, to the hospital, and in Kütahya, I took the bus. Public transportation is really cheap there. It's like less than $1 a day, and it just makes it a lot easier to navigate in different parts of the city. Because I was explaining. So I'll show you these pictures. This is the M2 metro in Istanbul. You can just see like Golden Horde and these, historic buildings, Topkapi Palace, Hagia Sophia, every day in Istanbul. It's really beautiful. But um, with this nice public transportation, um, the city feels more interconnected. So Kütahya has 250,000 people. My college town has 250,000 people. But to get from one side of my college town to the other, the metro area of my college town is going to take at least 30 minutes driving by automobile. It's going to take days walking. Um, Whereas over there, I can walk from one side of the city of Kütahya to the other in 45 minutes. And during my walk, I can, maybe get an ice cream or maybe have some tea or, see these beautiful historic sites and museums. So public transportation and walkability, big fans of those. Um, yeah. Again, during my time in Kütahya, I visited a bunch of other cities. With train and bus because train tickets and bus tickets are like $5 over there. So like I went to the city of Afyonkarahisar. I went to the city of Bilecik, Eskişehir. Every weekend I went to a different city. Um, Whereas in America, can I do that? No. I have to pay, a Greyhound bus would be like $200 and it probably wouldn't be very safe, right? So public transportation again, amazing in Turkey. And also they give you these awesome snacks on public transportation. So like on the bus, I enjoyed like this eticin, Ülker Biskrem, tea. This is me on the train going to Eskişehir. I mean, really good times. Historic sites, nothing we can do about it in America, but what I love about, Europe and Turkey is, you can go to these historic sites, they're everywhere and they're very beautiful. So like this is the tomb of Ertuğrul Gazi, the Turkmen founder of the Ottoman Empire. And this is the top of the castle in the city of Afyonkarahisar. Uh, Food culture is huge in Turkey. So like at the end of every rotation, we would have this potluck. Everybody would bring some food. And then during Ramadan, um, we would go to these iftar tents in the city where they would give free food, free lunch for free dinner for breaking your fast, called iftar. So food culture is really great over there. Tea culture, also amazing. Turkish people, they drink tea all the time. And the hospital, there's, ample opportunities to drink tea, free tea, and I really miss it. I mean, so like this day, one of my colleagues had brought cake, and my attending physician had brought simit, and I drank some tea during morning rounds. And this day, I enjoyed some kazan dibi with some tea, so, a nice Turkish dessert. Um, and then just hanging out and we have this in Turkey in America as well. We can hang out with colleagues, but I really enjoyed spending time with colleagues in America, uh in activities that didn't involve alcohol. And so it's really common to go out to dinner with your coworkers there. And I really enjoyed it. So like here on the left you can see me and my colleagues, Chala, and at Anur, and I had one of the best kebabs I've ever had. At Küçükev, a restaurant in Istanbul, and yeah, I just really enjoyed just the how close we were as colleagues over there, on all of the teams that I worked on, um, and then just some aspects of social culture in Turkey. All of our patients in Turkey, I got very close to them, and we would refer to them as teyze or amca, aunt or uncle, um, and not just in the hospital, but just in public. Older people we call, aunt or uncle. They'll call us oğlum, kızım, my son, my daughter. Um, some people would call us hoca, even though we're medical students. And if they're like slightly older than us, we would refer to like people as abi or abla, big sister, big brother. Um, and I just think these aspects of the language contribute to a more social, like interconnected culture. And the reason that's important is because when you feel like you're part of a society, uh, then things like universal healthcare make more sense. So I'll just share a very quick story and then end this long presentation. which is that when I was in my sophomore year of college, I took this class called Medical Spanish. And in that class, we had a debate on whether or not America should have universal healthcare, like in Spain. And one of my colleagues was like, "Oh, if you know," one of my classmates was like, "Oh, if we have universal healthcare, then homeless people won't have a reason to work anymore." As if like the only reason those people are alive is to get healthcare. I mean, there's this serious divide between rich and poor in America. Um, and people like our social cohesion is just not the same in America as what I witnessed in Turkey. Um, and I think because of that, we tend to assume the worst of each other. Not just rich people assuming the worst of poor people, but also vice versa. Um, and so, there's things we can do to make social cohesion better in America. Um, we can have, and I think that starts from city design. Having more public spaces, having more walkability, getting people to, talk to each other more. Because like right now, my life, for the last, in medical school has been, I drive to the campus and then I drive home and then I drive to campus, you know, um, and so I don't really know what the best solution to that is. Like, obviously, we can't redesign our cities in America. And the reason our cities are designed this way is because most of our cities are new. They were designed after the automobile. Um, but yeah, I think our culture in America um, can use some more social cohesion. That's just my opinion. So yeah, when I point out, so like again, I was born in America. I'm a proud American, and the reason I point out these differences and the reason I criticize America in this talk is because I think we can do way better as Americans. Um, if a country like Turkey has almost the same healthcare outcomes as us, why are we as the, greatest country in the world, the richest country in the world, why is our healthcare system so bad, compared to these other countries? Um, so hopefully one day we can have some sort of universal healthcare system in America. Um, so yeah, that's all I wanted to talk about. I wanted to also share this reflection. And if you guys have any, questions about my time in Turkey, just let me know. So yeah, thanks.